Lieutenant Colonel Barry Swanson, Salvation Army. Kind of a two-pronged question, Brian. How is the United Way going to reach out to the target population to engage them successfully in this program, reaching the individuals that you want to reach? And if that strategy will involve some of the historic partners, social service agencies of the Salvation Army, how and when will that program be rolled out of this? It's
Mike and Ann, I'll give you a chance to mention any local examples, but I think it's going to be two-pronged. One is sometimes we've got to go direct to consumer, to use a business term. And so 211 allows us to go direct to consumer, but a high percentage of callers to 211s across the country are nonprofit partners who are working with clients in their offices and looking for how to navigate the system and calling 211. So it will either be direct to consumer, where you're helping through volunteer sites, folks coming in and filling out their earned income tax credit, or it will be through partners. One of the things, and so that's the next launch in terms of the stage of the launch, is with what we call Leadership 18, the largest health and human service organizations in the country. We've already begun to have this conversation about this strategic direction and how they would play in it, how they would partner in it. But I think one of the things important to us, and a lesson we've had to learn at United Way, is we've got to do it in a way that makes it easiest for the person that needs the service. And if that means direct to the person, that's the way we ought to do it. And if it means partnering more effectively with our nonprofit partners, we should do that as well. Ann or Mike, any examples?
Well, I just would say that when I use the example of our Earn It, Keep It, Save It campaign, there are 200 partners with us. We need to reach these households through the places and the institutions that have relationships with them. And so that is with and through our nonprofit partners, our public sector partners, the departments of health and human services, and every community is a partner. So it's just impossible to do this work alone, as that has been our theme all morning, and it will most certainly include our existing partners in every community.
The other thing that's atypical is the conversations we're having with our business partners. So their consumers, for instance. And again, sometimes we think, those of us in the nonprofit world think always through that prism. There are ways to get access to thousands and millions of folks through non-traditional means as well, and we're exploring that also.
Suzanne Perry from the Chronicle of Philanthropy. Mr. Gallagher, I wonder if you could explain the connection between the $1 billion that was already committed and the new investment. Has the $1 billion been spent, and this is an additional?
It is. The $1 billion is in 2006. The amount of investment that local United Ways in aggregate spent on programming that is in support of financial self-sufficiency. So it's housing support, it's family service support to help folks stay in housing and so forth. Our commitment is, with this focus, to increase that $1 billion by 50% over the next 5 years, either by shifting more resources into this effort from other program areas or from growth in revenue. Any other questions? Okay, thank you very much. Appreciate your support.